everybody, and I am so excited to introduce my guest for today. Sometimes I feel like she's probably introducing me because she knows her story even better than I do. But I'm going to allow her to introduce herself shortly. I just want to say before she does that when we say healing is possible, we are proving this evening that it is. And so I'm going to introduce to you a lovely lady with a lovely story. How are you doing, ma'am?
I'm so good, so blessed. How are you?
I'm very good. I think the people want to know what your name is.
I am Andrea Harker.
Okay.
Um,
And Andrew, where are you from?
I'm from Kingston, born and bred all my life, and made my way to Mobe because I really wanted wellness. That was my main goal.
Yeah. We're going to talk about that. How young are you, Andrea?
I am currently 37.
Okay. Young stuff like myself. See, guys, when I tell you I'm young, there's proof. All right, Andrea. I honestly do not remember Andrea's story in detail. What I do know is that she has a lovely story, a really lovely story. And so if it seems as if I am being guided by her, the truth is that I am. Let me adjust this a little bit so you can see my face. The truth is that I am. Andrea, I feel like you came to see me earlier this year. It would have been maybe January.
Yep.
And I just want you to tell our viewers what was happening probably before that that led you to see me. I'm just going to listen because this is a refresher for me, to be honest.
Okay. So it was the beginning of the year, and I had made up my mind that I wanted to accomplish certain things. So some people have a vision board. I created a vision book, and it was all these things that I needed to either accomplish in 2021 or get the ball rolling on in 2021. Because let's face it, a lot of things stalled in 2020, and we know why. COVID hit, businesses were trying to recover. Being a senior manager in my own company, it was all about how do we keep the business moving.
Oh.
Go
ahead.
So I remember having a conversation with a mutual friend of ours for a few years, and she spoke about the fact that you really stripped away that concept of the multivitamin, the one-size-fits-all health regime for everyone, and you really took the time to analyze her and her body, what her needs were, and really put her on a track where she was the things that her body needed. And for me, it made perfect sense. And I saw the transformation in her. I saw her move from a place of just gliding through life to a place of wellness, genuine wellness. And I thought that, if I'm going to start with all these plans for 2021, let's start there. I was having back issues. I was having stomach issues. I was having gynae issues. Right? Issues are things that have plagued me from I was a teen. It starts out simple. Your periods come late, skip a month, come again, kind of thing. But you figure to yourself it's just growing pains, and as your body gets used to this phenomenon, it would stabilize. But as I got older, it was one thing after another. It was first of all having to have surgery on my cervix to remove a precancerous lesion. Then moving on to having PCOS. Then moving on to now having endometriosis. So it was kind of one thing after another. And that was an area of my life that I had just become content with trying to manage. And I had reached a point of management. But it was always from my mid to late 20s, the conversation was had with me to say, be prepared for the fact that if you want to have a family, you will most likely have to be very deliberate, and you may need some intervention. So even start wrapping your mind around in vitro. So I don't know how I really absorbed that at first, but I know eventually what it did to me on an unconscious level was almost as if put that out of your mind and focus on the things that you can control. And I became extremely career focused and then driven to control and achieve in those other areas in my life that I could control. But then I started to have severe stomach issues. I could not go a day without taking an antacid.
Wow.
And then it got where I couldn't go a day without taking something preemptively at the beginning of the day. And then I started to now have back pain and finding out that, okay, I have an SI joint disorder, right? So I was constantly back and forthing with physio, and I had an excellent physiotherapist and, you know, really did good work with me. But it was, you have to be deliberate in the way you sit. You have to be deliberate in the way you step out of a car. You have to be deliberate in the way you get a seat. And it was kind of like at the beginning of 2021, I thought to myself, I'm about to turn 37. And if I have all these challenges already, what's going to happen when I reach 60? You know? And I just decided there's so many things that I still have that I want to achieve. And I need to get these things out of the way first. And that was when I called up my girlfriend and I said, hey, that doctor you went to a few years ago, I definitely want to go and see him. And so she and I turned it into a whole road trip.
Wow.
I took the day off from work. We drove down and we came to see you.
Yeah. Yeah. So I think I remember that. And I do remember being, you know, I'm always excited to see people who have been told that there's no help possible. I don't know why. I think it's just a weird, like, I'm pretty sure at some point during our consultation, because I've become aware of it now, that I often say things that people tell me something really bad, like I have this really horrible condition, and I'll say, wow, that's nice. And they're like, no, it's not nice. I'm like, sorry, I'm sorry. It's not actually nice, but it makes me feel excited because I'm like, imagine if this person could get over this. You know, it's so I've had to learn to kind of tone that down, to not say, wow, nice, to kind of just accept that it's not nice for the person. But yeah, I do remember meeting you that first day, and I was excited as usual. I was looking forward to being able to help you, and I think the main focus we had at that time was really to get you out of pain. Can you tell us a little bit about what the pain was like for you, specifically the back pain and the gynae pains?
Well, the gynae situation, as I said, I had gotten to a point of just manage it, you know. So I wasn't really having pain per se anymore. It would be that I would have, unlike other people who would have cramps closer to their period, during their period, I would have cramps. I had gotten used to the idea of also having cramps during my ovulation cycle.
Wow.
Right? And kind of just, it had gotten, when I was much younger, to the point where I couldn't have a period without having injections for pain.
Oh, wow.
And I had made up my mind that the only way to manage that situation was to go cold turkey. And so the strongest painkiller I would take would be Aleve. And it would be like one Aleve, I'd knock the pain, and then once the pain was bearable, I would just ride it through, because I never wanted to get back to a place where you're so dependent on the painkillers that nothing is eventually working.
Yeah.
You know, and the thing with the Baralgin injection is that what would happen to me is that it would bring the pain down to a bearable point, but then I was still having side pain from the injection itself.
Yeah, yeah.
You know, because if anybody has had that injection, it can be a little uncomfortable, to say the least. So I had gotten myself down to a point of just management where that was concerned.
Yeah.
And it's kind of twice a month for me, I would just manage it. But the back pain was bad, because there was just a constant pain in my lower back and tailbone. I had a lot of, if I wanted to not be in worse pain, a lot of limitations of range of movement. I had to be very conscious of the way I got up out of a chair. I had to be very conscious of the placement of my feet when I was sitting. I had to be very conscious of how I'm coming in and out of a car. And the thing is that I knew that if there was ever a time where I got lax with things like that, then it was going to be that, okay, you're back in physio for a good course of time.
Wow.
And relearn those things. I had to be doing stretches twice a day. It got to the point where I was on a cocktail of 2 painkillers and a nerve blocker.
Wow.
Not something you really want to do.
No.
Nerve blocker would make me shake, and the painkillers, obviously, well, painkiller, muscle relaxant, you know, I'm not sure which one they were, but who really wants to be on a cocktail like that? You're constantly thinking about, what is this doing to my body? Is this sustainable? Because I guess I am of a mindset that if you have a problem, it needs to be fixed.
Say it again.
It's not learn to live with it and manage it, you know, which is maybe not.
Say it again. You say you're of a mindset. Let's repeat that part.
Okay.
You froze a little bit.
I'm of a mindset where if you have a problem, you try to fix it. It's not just accept it, manage it, and move on, because, you know, in my mind, and maybe that doesn't work for everything, but in my mind, I'm only getting older.
Yeah.
And at one point when I saw the doctor, and I said to him, what's causing this though? It's so out of the blue.
Yeah.
And he said, just natural degeneration. And I thought to myself, you're telling me this at 35. What's going to happen when I'm 50? You know, I haven't even had kids yet. If that is to happen. Yeah. So the thought of that was scary. Yeah. You know, thought of that was scary.
And I feel like, if I remember well, you had already had.
So it was, I need to not be in pain all the time.
Yeah, it sounded like you had had a keyhole surgery, if I remember well. Am I right? Tell me a little bit about that.
Sure. So I remember when I was in my late 20s, shortly after, and when I say shortly, like maybe a year or two, so after having a cone biopsy on my cervix, I was having constant cramps. And I kind of just brushed it off, you know, just one more of those things. And I noticed that initially started around my ovulation cycle, because by this time now, my doctor was watching me a little bit more closely, wanting me to kind of monitor cycles like that and stuff. So I knew that it was around my ovulation cycle. So I was like, all right, I know some women get ovulation pain. But then what happened is that when my period came, it just didn't stop. So I went to the doctor and he gave me something to stop the period. But then when in examining me, he said, your uterus is hardening. So I said, what do you mean by that? And he said, well, I think you may be developing endometriosis. And so I had laparoscopic surgery, exploratory surgery. So they went in, they made 3 incisions, tiny incisions in my stomach, one through my navel and one on either side, kind of close to my ovaries. And they went in and investigated, and they were able to burn off a small polyp. And after that, I was put on hormone therapy to try and keep my uterus, soft.
Wow. So all of this had happened before you came to see me. And then when I saw you, we did our usual testing, and, my thoughts were that you really had some crossed wires, essentially. You had some crossed wires in the pelvis, in the female area. And I thought to myself that, we know the diagram that I showed you, and I'll probably just show it here at this point, to explain why the wiring kind of is so important. And I learned this technique when I trained with some doctors from Germany. I started to understand how it was possible to use small injections of local anesthetic to kind of reprogram the body's damaged wires. And, I said to you, I don't want to say exactly what I said, but my plan was to kind of just get you out of pain, because it was distressing for me to see you in pain or describe being in pain all the time, and even more so during ovulation and during menstruation. And as you correctly said, you were pretty much just learning to live with the pain by controlling it with painkillers. And that's not my style. So we did our procedure, and if I may have like a small little diagram of what we did showing here. But I want you to tell me, first of all, what it was like preparing to have that procedure done. How did you feel?
I don't like needles. So let's start there. And I'm sitting in the office and I said, okay, so when would we do this thing? Because I'm thinking, no, all right, Andrea, big girl, you have to prepare yourself.
Yeah.
And just get it over with. You came knowing that anything was possible.
Yeah.
I mean, granted, I thought you were just going to give me, some vitamins. Tell me that you need more vitamin B. You probably need some iodine kind of thing. But when you said to me, okay, we're going to do a series of injections around your navel, I said, what do you mean by series? And when we're going to do this? And you said, no, we just want to go next door into the other room and do it.
Yeah.
And I said, Lord, all right. You came prepared for anything. It's a moment for, a long-term effect.
Yeah.
So that took a little quick psyching up, but I just kind of told myself that it's something that I needed to do.
Yeah.
I knew that I had made this commitment, and there was a point where I said to myself, girl, what did you do? You're in deep. But I knew that I had this commitment, and I really wanted the wellness.
Yeah.
And I wanted the long-term wellness for the gynae issues, but I also wanted that back pain to just stop, because people would say to me, so when do you have the pain? And I'd be like, always in pain.
Yeah. Yeah. So tell me, what did you feel during and I guess immediately after the procedure? And I'm honestly trying to remember because I don't have my notes with me, and I deliberately didn't check as I wanted to just hear you speaking organically about what you experienced. So tell me what it was like, or tell us.
It was like little pricks around my navel, and then there was one in the navel.
Yeah.
So there was you did the full perimeter of my navel, about 2 inches out.
Yeah.
All the way, and then one in the navel itself. And of course, nobody likes being stuck by needles, but it was painful. It was uncomfortable for sure. It stung. But like I said, it was just breathe through it and just remind yourself why you're doing it.
Yeah.
And then immediately after, I was told I might feel a little sleepy. I didn't.
Yeah.
Didn't feel sleepy. I felt fine.
Yeah.
I didn't have any tenderness really in the area. No serious. I think there may have been only 1 or 2 of them that bled a little bit.
Yeah.
And to be honest with you, after we were done and I rested, I went to lunch. I didn't have any alcohol, obviously.
Yeah.
Went to lunch and drove back to Kingston. And my girlfriend who was with me, she kept saying to me, you sure you don't want me to drive? You sure you don't want me to drive? And I was fine.
Yeah. And then we followed up with a procedure to the groin itself. Again, a bedside procedure, very small needle. I'll probably show a diagram or something again, just to explain what it's like. What was it like preparing for that second procedure?
Preparing for that second procedure, again, you have to psych yourself up because hearing the process can be scarier than experiencing it. So when you said to me, we're going to take needles down into your pelvis to do this reset, I just said, Lord, I'm trusting this man.
Yeah.
But I think it was a lot easier because we had done, I think that this was maybe about 3 weeks after we had done the initial procedure. And the truth is that I knew I was committed to doing this procedure because about within less than a week of doing the first procedure, I realized I wasn't feeling my back.
Yeah.
I wasn't feeling that heaviness in my back. I wasn't having the pain in my tailbone anymore. And I was like, okay. And I thought to myself, well, maybe it's just a carryover from the anesthetic and in time it will wear off. But you did say, let's do this more long-term reset. Yeah. And so by this point, I was committed to doing the reset because I had seen the results. I had felt the results. And I was like, well, if my back fix, I can get the belly fix, then, you know, that's important to me.
And I remember
because I didn't like the idea of being on these acid blockers every single day, you know, and I was like, where's the end in sight? So I was definitely prepared for it. I brought my mom and my sister along. To them, this was road trip fun time. Hey, let's drive to the bay. So, you know, obviously you're nervous. You're nervous because it is now a little bit more invasive. And I think you may have deliberately left out the injections in my neck.
Yes.
But like I was speaking to somebody recently, and I was saying, to be very honest with you, once all that was done, the procedure in the belly was not at all painful or traumatic in any way.
So, what was it like immediately after that procedure?
Immediately after that procedure, I felt good. I felt a little traumatized of everything that I've been through, but I felt fine. I didn't feel overly sleepy. What I did notice was that there was almost like you're feeling the nerves, you're feeling the blood flow in my lower abdomen.
Yeah.
And so you kind of felt like, okay, something happened. Yeah. And something is happening.
Yeah.
You know, something, either woke up, getting some messages, something, but you know, they're happening. Shortly after that, I noticed immediate changes in my body, right? From a gynecological perspective, I noticed that I was having increased, I guess, secretion, right? And I remember my period actually came early, and it was different than usual. Yeah. You know, the consistency of it had pain associated, but it was just different. And I remember I called you and I said, Doc, this is happening. Is this okay?
Yeah.
And I remember you reassured me. You said to me, your body is resetting.
Yeah.
And so I went with it.
Yeah, well, you know, if it's one thing I can remember with Andrea, is this. Well, two things. I definitely remember that your mom and sister were there with you while I did the procedure, both times. Well, the first time, maybe not. The second time, for sure, I remember them being there. And I remember having them watching over me like, son, you better do this thing right because, this is our loved one. And then the other thing I remember was being in office, and I think this is probably the ending of the interview because this is the like cliffhanger. I remember being in office probably about 2 months after, and Crystal, who is one of the team members, she normally, when I'm in with a patient, she normally watches my WhatsApps for me to see if anybody is kind of having an urgent issue. So Crystal bursts through the door and she says, Doc, I just got a WhatsApp that you need to see, and I think you need to see it before your wife sees it. I say, what could that be? And so she hands me the phone, and she's like, read this, you have to read this now. And I mean, Crystal's like really like upset because she's like, this is crazy. And when I read it, it was from you, Andrea, and it says, Doc, you got me pregnant.
Yes.
And of course, those who know me well enough will know that it couldn't have meant anything other than what you had intended, which is that you had managed to successfully get pregnant with, of course, your boyfriend. And oh my gosh, it was such an excitement in the office. I obviously didn't share it with too many people, but you know, like nurse who had been involved, I called her and I said, oh my goodness, look at this, Andrea is pregnant. And believe me, since that day, I don't know, for you, obviously it changed your life, but for me also, it gave me the confidence to really, what's the word I'm looking for? To extend myself, to more to people who are in the position where they don't feel like there's anything else that can help them.
Yeah.
You know, it might not have been my core training, but it's something that I'd learned. And one of the reasons why I train so much in addition to my core training is just for people like yourself who will walk through the door and say, Doc, I need something else.
Yeah.
And to see that, you know, you managed to essentially defy the odds. You're back pain-free. And within 2 menstrual cycles, you didn't even get the chance to have the second cycle, did you?
Nope.
So there you were. And how far along are you now?
I am now 7 months.
Wow, you froze a little bit. I have to get that on again. How far along are you now?
I'm now 7 months.
Wow. Wow.
And the truth is, that was never part of the plan. You know? And I remember my period was late, and I just thought to myself, part of the reset.
Yeah.
You know? This is nothing unusual for me. And when my period, you know, another 2 weeks passed, and I was about to, you know, go do my usual checkup. And I said, you know, roll my eyes. I know my doctor is going to ask me this question, so let me just get it out of the way. And I remember, like, in less than 5 minutes, it tells you give it 5 minutes before, you know, in less than 5 minutes, 2 big bright red lines, and I was like, wow. Lord, got to be kidding! You really have a sense of humor. Because at this point in my life, I was, you know, children were kind of on the back burner. Yeah. I was now, for the first time in a committed, steady relationship, and we had loosely spoken about having children, but the thought process was, let's discuss this later down in the year. Let's see how the year progresses, and let's discuss this later down in the year. So nothing had changed with my birth control regimen at all. Yeah. So the only thing for me immediately that came to me is that I am obviously much more fertile now. Yeah. You know? And like you said, it has changed everything. It has changed. I think my life has maybe 75%, 80% changed in the last 6 months. Wow. Including so many other things, you know, work as well. The same time I found out is the same time I got promoted. Wow. And I'm thinking to myself, how do I do this? How do I take on this very big role in the midst of wanting to sleep all the time? You know, but I think it was just, for me, spiritually, it was very much, and for my partner as well, very much a teaching moment of God saying, listen to no one but me. Yeah. I'm the one in control.
And it's one of the things I also wanted to say is that it's so difficult when you've been told repeatedly over and over that you're not healthy. You know, this is your life now. There's nothing else. This is your life. You are going to be on painkillers. don't really think about kids because it's going to be tough. That kind of programming, although it may be rooted in facts, it has impacts beyond, in my experience, it has impact beyond just the problem that we as physicians are speaking about. It puts the client into a mindset that affects their whole life.
Yep.
You know, and I'm just so happy for you, Andrea. You have no idea. Like, I guess people, from a marketing point of view, people say, oh, this is great for you. Like, you know, you could make a whole business around this. And, you know, let's see what happens. And people have heard your story. And I guess as they hear this more clearly, they'll be like, oh, well, I need to go see Dr. Andre. But to me, I can never see another patient knowing that I helped Andrea. Yeah. And that's totally fine for me. So, yeah, I guess this is the end of the interview. Is there something that you'd want to say to somebody who finds themselves in the same position?
Boy, I would say think outside the box. I don't say, you know, go searching for these miracle cures and these one-off things. Focus on wellness. And, you know, for me and my story, even though this is something I never thought I necessarily wanted, what it has really done for me is made me be able to say to other people who I know have been trying for years, to say, never give up. You know, and people who really, really want it, don't give up.
Yeah.
You know, talk to him.
Yeah.
If it's not feasible or if it's rooted in something else, he'll tell you, but focus on your wellness first and see what can happen. And
wow.
Because of that, I have really pushed a lot more people who I know to go in that direction.
Yeah.
Just go beyond what you've been told and seek an alternative, and don't give up. Definitely. And sometimes you get some really unexpected results. You know?
Well, you know, before we go, I just want to say that I'm also not just excited for you, but I'm excited for where you're going in the next, who knows, 1 to 2 months or whenever God decides. I'm wishing you a very, very safe delivery.
Thank you.
And specifically a very uneventful delivery. Yeah, and I even want to say a pain-free delivery. Who knows? Who knows what's possible? Yeah,
but everything has been, you know, even just being quote unquote high risk. Yeah, I've had none of those issues.
Excellent.
So it is just all coming back to God's timing and God's plan and following and working with that.
Excellent, excellent. Andrea Harker, thank you so much. We are
You're most welcome. Thank you too.
Yeah, we want to see pictures with the little, well, I mean, not say boy or girl. We just want to see pictures with the little one when that time comes. You keep that secret. That's your business. All right. Thank you so much. And I know this is going to bless somebody. Have a great night.
Thank you too.